So that meeting with
Yeah,
Laura,
everything went really well.
But that meeting with Laura on Friday that she put is just like a catch-up meeting.
Okay, yeah, you've seen about me. So, yeah.
You know, you're doing so well now. You probably get asked this all the time. How did you first get into research, and how did you go about finding mentorship?
Yeah, you know, it's funny to look back on it now, and it wasn't that long ago, but it feels strangely like it's been a couple years now. And I remember when
It's been a long time.
It's been a long time. Yeah, I know. and I remember when I showed up in Boston from San Francisco. I was at UCSF for residency. I came to MGH for cardiology fellowship. And after my first year of spending time in the cath lab, I recognized I want to be an interventionalist. And I remember sitting back and exploring my research opportunities in Boston, which, you know, we're really lucky to have so many great opportunities, both within Mass General at the time and outside of it. But what I recognized early on when I met you was the dedication to me as a person and my career development, and not just this idea of here's your role, here's a paper you need to publish, these are the metrics to get through to the next phase, and then you're off on your own. And so that personalized mentorship, I got the feeling from right away with meeting with you, and it'd be great to hear how you felt about that when I approached you with the idea of working with you for a couple of years.
Yeah, you know, it was not that far into my career as an attending. I would say I've probably been an attending for maybe three years. When you're a junior attending and people are coming to you for mentorship, you can be pretty insecure about that. You can wonder if I'm qualified to do it. You have to really pick the people who you're going to mentor, because that mentorship is a commitment. That's a relationship. It's not like a one-off. It's not every 6 months I'm going to say hi and that'll be it. You're building a longitudinal relationship with someone where you're really invested in that person, and that person really needs to be invested in themselves and the process. And so for me, it was clear within 5 minutes of talking to you that you were highly dedicated and ambitious. You had a track record, and you had a really good sense of what you wanted to do. And I think it was clear that it was going to work well. But at the same time, I knew that I wasn't senior enough at that point to sort of take this on my own. And so that's why we involved, someone more senior, Laura Morey involved, who had been my mentor too. And so we brought you into sort of the mentorship family. I don't know if you felt that at the time.
No, it was such a strength to the opportunity that wasn't initially apparent. I came to you thinking that it would be this one-on-one mentorship pathway, which would have been great also, but then to involve Laura Morey, who at the time had been working on the DAP study, and have this whole extra component built into my research program was really an added benefit.
People are coming to you now. I mean, you're junior faculty now. You're in year 2 of being an attending. Probably feels like you've been an attending for longer than that at that point.
Starting to, I know.
Like when I look at you, I see an attending. I don't even really think of you as a fellow. I think of you as a colleague and not necessarily even a mentee anymore. You're starting to make that transition to mentoring many residents and fellows who are coming your way. What's that experience been like, and how have you been going about doing that?
Well, it's funny. Now being in the role, I look at my mentees, and the first thing is, how do I get them to succeed, and how do I do what Bobby did for me? And it's tough when you're a junior. I mean, again, and I respect what you said when you were 3 years in when I approached you. You're still developing your own name. And I think the most important thing that you did for me was prioritize me getting those, when I had a paper, I did the interview, with the news. When I had a paper, you emailed my program director and said, look what Eric did. And so those are the type of learning, points as a mentor that I picked up, and I've been trying to apply to my fellows and residents who want to work with me. But
we've had this conversation before, and I think you and I both agree that where mentorship often goes wrong is when somebody feels insecure.
Yeah, absolutely.
And when the mentor feels not secure about his or her position in the world and their academic status, they're not getting sufficient recognition to feel good about themselves, that's when I think bad mentorship things start to happen, like fighting over authorship position, or not wanting to give a mentee who wrote 90% of the paper a first authorship or an interview with media. And I think we've been fortunate, and in part it's been built on generations of mentorship that we've had. I mean, we're part of a lineage of mentorship that really starts with people that we've never even directly worked with. Mm-hmm. Rick Kuntz mentored Laura Morey really effectively, and Laura became an excellent mentor. And Dr. Morey mentored me, and I mentored you. You've worked with Laura. We both know Dr. Kuntz. I mean, I think that, and now you're mentoring people. We have these generations, and this family is built up in a way that everybody feels good and everybody feels confident, the ability to pass down credit where credit is due and step aside. And I think this PhD work that you're doing is just such a good example of how you've made that transition to becoming an independent leader, nationally recognized for your work. And my role in that is to really step back, I think, and to watch you do what you do.
And that's hard to find. I mean, there's not a lot of mentors who can do that. It's hard to pull yourself away a little bit from wanting to be on the front line. So it's a culture. I think that's really what it is that you and Laura and Rick have developed, and I've tried to continue. And the biggest issue right now is with trainees is the desire to publish.
Yeah.
And I spend a lot of time when I meet with trainees, and I do like a fellows talk at the beginning of the year, is a mentor-mentee relationship is not about the number of publications you get in a year.
Yeah.
You're building something exactly what we did, where the goal is to have a lasting relationship where your mentorship leads to a job, whether it's at the same institution or another one, collaboration and continued work. And that doesn't happen because you published 100 papers in a year. It happens because you have trust, you have reliability, you have a focus on the quality of the work, and that is not always in line with just the number of publications, as we all know. And I think that's a really important tenet in terms of mentorship right now, is getting over that desire to publish and looking at other metrics of mentorship that show the strength of that bond.
Yeah, and what do you say to people who maybe are struggling to find good mentors? What's your advice to people who are maybe trying to decide between a couple, or maybe they don't have access to people who are interested in what they're interested in?
Yeah, the access is always an issue, and my first approach to that conversation is you don't have to do on your first project exactly what you want to be doing. So I'm vascular, and I get fellows who come to me who want to do structural, but they want to work with me, and I say, well, listen, I don't do a lot of structural research right now. I know this vascular research isn't a clinical interest of yours, but we're going to learn something from it. We're going to learn how to use this data set. We're going to learn some statistical method. We're going to get you involved, and that's the first step. And so, I think it's being open-minded to the idea that you can't necessarily always, and you shouldn't always want to match your mentor completely. You have to be open-minded to other opportunities, and then you pave a way. And exactly what I was able to do with PhD is I take what you taught me in the coronary space, and I take those same techniques and bring it in the vascular world, and it's let me have my own parallel career with you. And so, but access is always a tough one, but there's always good mentors, and you walk around a conference like this, and you just get connected with these people who are doing amazing stuff all over the US and the world, and that you just have to reach out and find the right person that meets your requirements.
Well, it's been amazing to watch you go and develop in your career, and I think I'm only looking more forward to what's going to come.
No, I've been very appreciative, and I hope a lot of people can learn from this relationship.
Absolutely.
So we should run, but
all right, we got to go.
Yep.
Okay.
Great. Good talking to you.
See ya.
Thank you.